This is a brief presentation on the basics of ultrasound imaging. Sound is essentially just mechanical energy transmitted through a medium. Sound has the characteristic that it can appear either as a wave or as a particle. It's got a direction and it's got an amplitude. Ultrasound imaging uses sound in the megahertz range, which is millions of cycles per second. The piezoelectric effect describes what happens when you strike a transducer with a high voltage. It produces a mechanical shock wave. When it hits a target, it's reflected back to the transducer, where it's converted back into an electrical current, where it's amplified. Different tissue has different impedance at the interfaces, and the basic differences would create an image with various properties. The differences include reflection, refraction, and scattering of the ultrasound signal. Attenuation describes how sound is absorbed and dissipated, and the signal becomes weaker as the ultrasound travels through the tissue. Higher frequency has more attenuation and less penetration. The focal zone of any given transducer tells you in which area you're going to have the best resolution. The axial resolution, as described here, is the ability to discriminate between two objects parallel to the beam. It's highest at high frequencies. Lateral resolution is the ability to discriminate two objects perpendicular to the beam, and this is maximum at the focal zone. The trade-off in ultrasound is that the higher the frequency, the better the resolution, but the poorer the penetration. With lower frequencies, you get better penetration, but you don't get as good resolution. In practice, we want to choose the highest frequency probe we can based on the depth we're scanning. So we'll choose a 7.5 megahertz probe for superficial structures and a 3.5 megahertz probe for deeper structures. The two artifacts you should be aware of are acoustic shadowing, which occurs when the ultrasound hits bone or something hard like a gallbladder stone or a kidney stone, and you'll see a shadow behind that structure, and that's an artifact. And acoustic enhancement describes what happens when ultrasound goes through a liquid such as blood in a vessel or urine in a bladder. You'll see an enhancement behind the structure. Both of these are artifacts. There are several controls on your system that you can use to optimize the image, although using your presets will generally give you the best image. You want to choose the highest scanning frequency for the penetration you need. You want to adjust the gain both in the near, mid, and far field to give you the most pleasing image with regular brightness throughout the image, as well as contrast and overall gain settings in intensity that basically are qualitative, and everyone has a different preference for that. The time gain compensation, or TGC, adjusts for the attenuation of the signal through tissue, and if you don't compensate by amplifying the deeper echoes to a greater extent, you won't get an even looking image. So that's what the TGC controls are for. And again, the presets will give you usually a pretty good image. Here are examples of three different images. The first, I think, just enough gain gives you kind of a very even look throughout the field. With not enough gain, it's very dark and you can't see all the structures, and too much gain, you kind of blow out the different structures. So you really want to use the setting that gives you an even look throughout the whole field. So thank you very much for watching, and please don't hesitate to contact us for more information.